Dr. Bentley. Do you actually drive a Bentley?
No, I don't.
Oh, come on.
I drove one I didn't drive one. I got driven in one for my wedding, but no.
Oh, that's pretty amazing.
Yeah, but that's about it.
You should totally get one. I mean, Bentley, and then your number plate should be Bentley as well. You can have a lot of people going, oh, why would you put Bentley, the name of the car, on it would just, but it would be amazing.
Yeah, it would.
And then when you tell them the story, no, that's actually my surname.
I did get a newspaper advert off the side of the road, which was Bentley on speed, when they launched a new sports model.
I love that. First of all, very honored to be sitting next to you, chatting about something that has been bothering me for a while. So for those of you who don't know, this is the Dr. Bentley. You're a sleep expert. And straight out the gates, I want to find out from you, as an expert, how would you define good quality sleep? What does that entail?
It's a very difficult thing to define. I mean, I don't think across the world, people who do sleep research, I don't think we have a really good handle on what sleep quality actually is. And people define it in different ways. So patients will define it, I have a poor quality sleep, and I always say to them, what does that mean to you, like quality sleep? Certainly there's no question that if you have a good quality sleep, you should wake up feeling rested, you should feel ready for the day, you shouldn't feel tired during the day, you shouldn't feel sleepy during the day, you should feel ready to go. That's what we would define a quality sleep. But how do you define poor quality sleep is very difficult, except to say you don't wake up feeling rested. Like it's a bit kind of back to front. Does that make sense? Like, okay, so you don't feel rested. But some patients go, I don't have poor quality because I wake up so many times a night. I don't know why I have poor quality. I sleep fine and I wake up feeling like I've been hit by a truck in the morning. So that would be defined as poor quality. But it's a difficult thing to...
I hear you.
To actually put a handle on. Like, what is it? How do we measure it?
People are all different, right?
They are. And I mean, all we do to measure quality of sleep, we go from 1 to 10. Like,
okay.
What is it? And the problem with that is that if you have something like sleep apnea, for example, sleep apnea doesn't just suddenly start one day, right? It gradually comes up on you, okay? It gradually gets worse and worse. And how you feel in the morning tends to normalize, right? So you kind of go, I feel a bit lousy this morning, but I had a bad day at work yesterday. Maybe it's about that, right? And as you go on, that kind of becomes the normal. So you see that as okay. And then it gets a bit worse, and then but after a little while, that becomes okay. So routinely, when we have patients who have sleep apnea, and we put them on CPAP, which is the treatment for sleep apnea, they often wake up within 2 or 3 mornings, and they're going, I haven't felt like this for 10 years. I thought I only had a problem for 5. But what I had before that, I wasn't sleeping well. I didn't know that.
Wow.
Okay, so not only is quality difficult to measure, but we don't know if we're getting good quality sleep either, because we may have had this kind of quality our whole lives, and we didn't know it was wrong.
Yeah.
We didn't know it was abnormal.
So for those who don't know what apnea is, could you do like a very basic introduction, essentially?
So apnea is often described as you stop breathing during your sleep, right? And that's really scary, because the thought that your brain would stop breathing in the middle of the night is not fun, but it's not that. So apnea is related to snoring. Snoring is like the entry drug for apnea. And what snoring indicates is a partial obstruction. So something's obstructing the airflow as it's moving between your nose and lungs. There's a little obstruction, so just as you open a tap and there's a nice smooth column of water, if you stick your finger in a little bit underneath that, you get this turbulent air.
Of course.
When the air is, or turbulent water, when the air is turbulent in your throat, it usually hits the back of your palate, so that little baby tongue, and it goes at the back like that.
You're a good snorer.
I'm a very good snorer. Done on TV often. So you get that little vibration, right?
Yeah.
And so it's coming from the palate, but it's not the palate's fault. It's usually the nose. It's usually some problem in the nose. Now, apnea happens when you're breathing in at night and you have to suck so hard to get past that obstruction that you suck the whole throat closed. Those of you who are my generation remember the old paper drinking straws, not the cardboard ones you get now to save the planet, but the old paper drinking straws that if you left them in your cool drink for a little while and then you tried to suck through them, they would collapse like that. And when that collapse happens, you continue to breathe. I mean, your chest is trying to breathe, but your brain has to wake you up to start breathing again. And if you do that 200 times a night, then you're going to wake up feeling exhausted because you've been woken up so many times during the night to restore breathing, or restore airflow, let me say, rather than restore breathing.
That's very scary.
It is scary, and often the wives are the scared ones. It's mainly in men. It's a 2-to-1 kind of thing, much more likely to happen in men. And the wives are the ones that are awake at night listening to this gap in the snoring. So the snoring they're kind of used to. This gap in the snoring, and then this wake up at the end with this kind of thing. At the end, that's the big thing. So if there's that catch in the breath, or there's that sudden kind of great Afrikaans word, snork. Okay, that's snork. That's an indication of apnea, and that's an indication that you're woken up. And that's the problem.
Gosh, I feel like I need to film myself to see if that happens to me.
I've seen lots of videos. I've seen lots of videos from wives, because the wives go, I've told him he's been snoring for 10 years and he never believes me. And I look at the husband and I go, why would she lie about this?
Exactly.
What is the point? And videos, and she says, here's the video. And I go, I don't need to see the video. I absolutely believe you.
Yeah. So how does sleep impact our overall health and wellness, and what would you say are the potential risks of somebody with chronic sleep deprivation?
So it's interesting that now, and I mean, sleep medicine is about 50 years old. It's not an old medicine. It's a very new medicine. But there's now good evidence that every single sleep disorder affects long-term health. And that's not, we're not talking sleep health, we're talking other health. So for example, insomnia, if you have insomnia, increased risk of having depression for the rest of your life. And a high risk.
Rest of your life?
The rest of your life. So a really interesting study done on doctors at Harvard in 1965. And they did a little questionnaire before they graduated. You know, from psychology kind of does a questionnaire. And one of the questions was, did you have trouble sleeping during exams? And if they answered yes to that, and they followed them up 35 years later, it's easy to find doctors, they have to be registered, right? So 35 years later, they found that those doctors who answered that question, yes, I had trouble sleeping during exams, had an increased risk of depression 35 years later.
What?
I know, it's huge, right? It's ridiculous how it's connected. There's no question that if you have depression, that you're likely to have insomnia as well.
Yes.
We know that if you have insomnia, depression can be harder to treat. So depression, just mental health. Anxiety is also linked to sleep. I mean, if you can't sleep, you tend to get anxious. If you are anxious, there's an increased risk of having insomnia. And so the whole thing just becomes this...
Yeah, then you're
it just
anxious
runs.
about being anxious
Yes.
because
And
you're
not
not sleeping.
sleeping.
Yes.
So often insomnia often starts what we call a precipitating event, some life stress event, death
Yeah.
in the family, I don't know, getting retrenched, something like that, and you can't sleep. And most people who have an acute sleep problem like that, it'll disappear. 75% will start sleeping well. 25% of the people start getting anxious about that. So instead of being anxious about the issue, they get anxious about their sleep. So it kind of switches, right?
Okay.
So now I'm worried. So the life stress has kind of disappeared, but now I'm worried. I haven't slept well for a week. I hope I'm going to sleep well tonight. Now the thing about falling asleep is you have to be sleepy, you have to be safe, you have to be comfortable, and you have to let go. Sleep is a very passive process. You can't make it happen.
Yes.
The harder you try, the less likely it is to happen. You have to be sleepy, then you just have to be in a comfortable space, and you just have to go, breathe out. If you're anxious, you can't breathe out.
I wish it was that simple. You know,
It
as you're
is.
saying it, I'm like,
No. It is. But the thing about anxiety, when I see patients who have anxiety, after 5 minutes, I'm going, breathe out.
Yes.
Like, just breathe out.
It's always the simple things.
And they're
right?
kind of like, because they're like this, right? They're super anxious. So that's insomnia. And so just depression, right?
Yes.
Sleep apnea is linked very strongly to things like cardiovascular disease, diabetes. If you have moderate to severe insomnia, and we're talking stopping breathing 20 times an hour, which sounds huge, but it's not that huge. Just wouldn't even be my record for the week, for the reports that I write.
Excuse me?
Wouldn't be the record. I have patients who come in with 55 an hour, and they go, oh, doc, that must be the record for the week. The record for the month, and I go, not even for the week. We've had a 75, we've had a 90, we've had a...
What?
That many times
How
they
are they
stop
still
breathing at
alive?
night. I know, but they are. And no one knows it's happening, right, except their bed partner. That's the only person who knows it's happening. And then they don't believe them. So it's ridiculous.
Why does it feel like a flaw in the anatomy?
What, the flaw?
No, the fact that we are like, you've got this issue that could potentially kill you and
Yeah.
lead to all of these things, you know?
Because doctors only see you during the day, right? And so you come to them with a problem.
That's such an interesting
And
point.
if you don't come to them with a problem of, hey, my wife says I snore and I stop breathing at night, why would your doctor think about that when you're coming with a cough or a cold? Or generally what patients with sleep disorders go to the doctor with is fatigue. They go, I'm tired. And what needs to be asked at that point is, are you tired when you wake up? Okay, because there's fatigue physical fatigue. Like you run the comrades, you're going to have fatigue, right?
Yes.
There's mental fatigue. If you write an exam, you're done, right? You just want to watch something silly on YouTube. So there's mental fatigue, there's physical fatigue, and then there's sleepiness, which is a different kind of fatigue. And it's a combination of a mental fatigue, but there's no reason for it. Like you wake up in the morning and you feel like you've written an exam. Right?
Yes, yes.
That kind of thing, and you're just tired the whole day, and you what we call your executive functions have gone off. That's the first thing to go, is the executive functions, and that's things that make us different from chimpanzees. I mean, I'm sure you've heard like 99% of the genes, we're about the same.
Yeah.
What we have is a prefrontal cortex, and it sits in the front of our brain here, and it does everything that we do that's different. So the fact that we can write and communicate, and that we think laterally, that we think innovatively, that we have effective communication, that we're tolerant, that all of that kind of stuff is taken away if you haven't slept, because you are grumpy and you're moody. And people talk about having tunnel vision when they're tired and they drive. So they drive from their home to work, which they do every day, and they're fine with that. But they get to work and they kind of go, don't remember a thing.
Scary.
That happens. I was safe. I was driving appropriately. I didn't speed, I didn't do any of that. But I was so tired that I had to focus so much on what I was doing that I couldn't notice this. Okay, and that's the kind of thing. So there's a daytime function component to it that happens immediately, and then there's long-term health stuff. So sleep apnea, increased risk of diabetes, increased risk of cardiovascular disease, increased risk of liver disease, increased risk of random things in the eye. I'm sick and tired of trying to find a disease that sleep apnea does not impact.
What?
Well, every time you have an apnea, every time you wake up at night, there's a little surge of adrenaline running through the body, right? So, and the brain goes, what are we doing? What are we doing? Right? The whole body's going, we need to prepare. I don't know what for, but we need to prepare. Like, it's adrenaline, we need to prepare, something's going to happen. So let's push out a bit of glucose. Heart rate goes up, blood pressure goes up. Oxygen's going down because you're closing off. All kinds of stuff are happening in the background of your body while you're having this apnea. So apnea is related to obesity. So if you're overweight, particularly as a man, you put on weight here, kind of squeezes that little tube closed a little bit, so making it more likely to collapse. Well, we know that if you have sleep apnea and you do the whole diet and exercise thing, it's a lovely phrase they have, it attenuates the expected results.
Attenuates.
Attenuates, lovely word. So what it means is that if you diet and exercise and you expect to lose 10 kilos, that doesn't happen anymore. And the reason is because in the background, for 8 hours of your day, things are going crazy, right, when they should be resting. So when your pulse rate should be low and your blood pressure should be low, that's not happening anymore. Your body's in flight and fright. Cortisol.
Yes.
Adrenaline.
Yes.
All of that kind of stuff is running at night, which it shouldn't be running.
So you need melatonin to kick in to get you to sleep, right?
Well, partly, but I mean, there's other hormones. So, for example, growth hormone as an adult, all the growth hormone you produce is in the first hour of sleep. Sleep, not night, sleep. So when you have your deep sleep at night, you have your big surge of growth hormone. Now, we're not growing, except maybe a bit sideways, but we're not growing. But what happens, it's repair. So it's repair. So that growth hormone then flows down and we get somatomedin, somatostatins, insulin growth factor, nerve growth factor, all of those kind of things that then repair what's been damaged, used during the day, right? If you don't have that growth factor, then that doesn't happen. And so you're sliding towards a situation where your body is not repairing itself. So cardiovascular disease, diabetes, these fat cells in your body that are not responding the way that you expect them to respond to diet and exercise, because they're in a flight and fright kind of situation all the time.
Gosh.
And so it's a much bigger thing than just I wake up feeling tired.
Yes,
Does
of
that
course.
make sense?
No, definitely.
It's really right through the system. I met a liver specialist, and I was saying to him, we really need to look at how liver connects to sleep, like I'm sure it does, right? So he looked at me and went, I don't think so. So I found an article and I sent it to him and I went, here it is. So he now sends every single patient with that particular disorder, fatty liver, to me for a sleep study, and every single one of them has got sleep apnea. Wow. Because again, what that adipose tissue is doing, the fat tissue is doing, is releasing lipids. Why? Because you need energy. If you're in flight and fright, you need energy. Releasing lipids, which all go to the liver, get stored.
Oh, man.
I know. Crazy.